President and Vice-Chancellor, as public orator, may I, Professor Graham Shipley, present Nigel Hewett, a candidate for an honorary degree. Nigel Hewett is a retired GP, general practitioner, who grew up in OBE in the 1970s and still lives in the area. While in secondary school at Beecham College, he was inspired to pursue medicine by seeing the work done in his own local doctor's surgery. For the past 40 years, he has been a pioneer in improving healthcare for individuals experiencing homelessness, first in Leicester city centre, now across much of England. After graduating at the University of Birmingham in 1980, Nigel joined the Leicester Medical School vocational training scheme to train as a GP. After qualifying, an opportunity arose to gain a new experience and make a difference in the wider world. This involved working with his wife, Fran, also a GP, for 2 years in the Amazon jungle of northern Peru. Nigel recalls that at one stage they only had 8 basic medicines to prescribe, but the most important part of their work was working sensitively with the leaders of several remote population groups who often had a history of hostile relations between them. They were aware of modern medicine and wished to benefit from it. Nigel's work was led by the wishes and needs that they voiced, while also involving giving extended training to village health workers, especially women, in basic modern health care. This formative experience also satisfied a need within Nigel to help those on the margins of society. When he returned to practice in OBE, he became aware that the numbers of people sleeping rough in Leicester was growing and that they had no access to healthcare. Becoming homeless often hits people without warning, causing them to lose any structure to their life, such as job, home, and family. If you didn't have an address, you couldn't register with a local doctor, even if you were spending each night in the same homeless shelter, as is still the case today, if there is no specialist service, which means that people often resort to accident and emergency departments. And as we are all aware, the problem of homelessness in Leicestershire only continues to grow, with the latest figures showing 60 people sleeping rough each night in the city alone. In 1990, Nigel began working part-time in the city, treating homeless people. And in 1997, he became the founding chair of the Leicester Single Homeless Multidisciplinary Team, drawing together health, housing, and the voluntary sector to work collaboratively. 3 years later, he set up the full-time Leicestershire Homeless Primary Healthcare Service. In the early days of this work, Nigel would take 2 half-days out of general practice at OBE and make himself available for daytime clinics in the city centre. In the city centre night shelter and drop-in centre, enabling homeless people to access primary care. Over time, he won additional public funding for this project to go full-time and employ a full primary healthcare team. He gathered and published a mountain of data showing how great the need for this service was and how successful the team were in improving outcomes. In 2009, he was invited to set up University College London Hospital's Pathway Homeless Team, providing GP-led hospital in-reach for care coordination of complex cases involving homelessness. The model that he and his colleagues developed over the years became the pattern for similar schemes across England. In 2010, he was a founder member of the Faculty for Homeless and Inclusion Health. This faculty has significantly advanced research and education in healthcare for excluded populations, showcasing Nigel's commitment to academic excellence and societal impact. In 2011, he became medical director of Pathway, a new charity aiming to improve the healthcare of homeless people and support the faculty. The network of Pathway teams continues to grow, currently reaching from Brighton to Bradford. Nigel's work has actively supported Project Light, the interprofessional student-staff partnership providing health promotion to Leicester's homeless population, and based at the University of Leicester. This encourages our medical students to undertake work on society outside their curriculum, and they learn a great deal from it every year. In 2006, Nigel was made a Fellow of the Royal College of General Practitioners and received, for his services to homeless people, an OBE, a national honour, recognising exemplary leadership and impact across a wide area of the United Kingdom. His career has been one of outstanding civic achievement. We welcome him today to celebrate his profound contributions to public health, social inclusion, and academic innovation, both locally, in Leicestershire, and nationally. President and Vice-Chancellor, I present Nigel Hewett, OBE, that you may confer upon him the honorary degree of Doctor of Science.
President and Vice-Chancellor, honoured and distinguished guests, graduates and graduands, I'm truly humbled and delighted to receive this honorary degree and to be allowed to share this significant day with you all. And particular thanks to Professor Shipley for that very flattering oration. Well, don't you all look marvellous in your gowns? I've always been rather partial to a hat, but this is the first time I've been able to wear such a magnificent one in public and get away with it. So yet another reason to be grateful to the University of Leicester. I've been wondering for a while what I might usefully say to you, trying to think if anything I have experienced or been taught might have any bearing on your exciting and unimaginable futures. Looking back, the most accurate thing I was taught was not perhaps the most useful. In the first week at medical school, a thoughtful lecturer said, "Half of what we teach you here will turn out to be wrong. Your problem is that none of us know which half." Of course, we laughed, but that's turned out to be the absolute truth. Now, don't get me wrong, randomized controlled trials are the gold standard for medical evidence. Vaccines are safe and save lives. But much of what we were taught was based on opinion or has been superseded by subsequent research. For example, we were taught that gastric ulcers were caused by stress and type A personalities and required major and life-threatening surgery for a cure. It turned out that most ulcers are caused by a Helicobacter pylori infection that needs a couple of weeks of antibiotics and acid-blocking medication. Bed rest was absolutely vital for everything from heart attacks to hip operations, but we now know that this increases the risk of thrombosis, worsens mortality, and delays recovery, so most people are kicked out of bed the next day and out of hospital a couple of days later. Then, more insidiously, we were taught that very poor people were unhealthy because they made bad lifestyle choices, because they lacked motivation, were badly educated, and probably stupid. It turns out that inequality becomes systemic when it is perpetuated by adverse childhood experiences, which are rooted in poverty and themselves drive attachment disorders, complex trauma, and addictive behaviours, the unholy triad of physical ill health, mental ill health, and addictions, which are at the core of most long-term homelessness and have been central to my work. All of this, the direct consequence of the profound inequity inherent in condemning children to be brought up in poverty. Change has, of course, also been very apparent outside the medical field. My generation was brought up on white sugar and second-hand cigarette smoke, both of which are now apparently not ideal. And even during a relatively stable period of history, so many apparent certainties have changed. Political empires collapsed and financial institutions failed. Our understanding of the past has evolved, along with scientific hypotheses about the future. Everything has changed and will continue to change. Perhaps the first life lesson then is that sometimes you might be better off not listening to your elders and betters. Half of what they think they know is wrong. The one thing I am certain of is the benefit of finding a life partner who can make up for all the qualities that you lack. In my case, my wife Fran conceals my many faults with her intelligent foresight, empathy, kindness, and a remarkable ability to remember people's names. The second life lesson, therefore, is to choose carefully and be lucky in your relationships. I hoped I might get some useful ideas when we recently attended a reunion of our graduation class of 1980. It's 45 years since we graduated, so I invite you to look around and imagine meeting up with this lot for a graduation reunion in the year 2070. What might you talk about? In my experience, it's unlikely to be about how much you earn, what car you drive, or how high you climbed up the greasy pole of ambition. We wanted to know, how is your family? Do you have grandchildren? Are you well? Where are you living now? What are your interests? In other words, are you fulfilled? Are you happy? So if everything is changing and nothing is certain, what should you do? What worked for me was finding my passion. I wasn't a brilliant scholar. As you heard, I scraped into university from my state school and wondered if this was really the place for me. But despite being repeatedly advised against working overseas or working with people on the streets, I found my place and my career among people on the margins of society. I found many shared lessons and my purpose by standing alongside disregarded communities, from Peruvian jungle guardians to people experiencing homelessness in the UK. My final life lesson, then, is perhaps a suggestion that you might think less about what is expected of you and more about what your passion might be and how you might pursue it. Thank you very much for listening. Enjoy this lovely day, and well done again to you all.